COVID-19 cases in India have crossed a million mark, and the deaths have crossed 25,000. Well, this is the time, folks, to have a deep focus on coronavirus issue, coronavirus pandemic in India. But while I give this figure, which is all over in the papers, that is total caseload crossing a million mark and deaths crossing 25,000 mark. Yet there is a silver lining. There is a case for India to be slightly satisfied, if not happy. Let me give you a comparative study. This comparative study involves 10 countries, including India. I am Rajeev Sharma. Well, if you talk about the per capita indicators, that is cases per million population, deaths per million population, then India is not doing too badly. Well, the source of this study is our World in Data, howindialives.com. The number one in the table, in the world table of cases per million population of COVID-19 is UK, followed by Italy, then US, then Peru, then Chile, then Brazil, then Mexico, then Iran, then Russia, then comes India, way below. UK cases per million population as per our World in Data is 4292. Italy 4025. US 10,367. Peru 10,126. Chile 16,713. Brazil 9,065. Mexico 2,416. Iran 3,121. Russia 5,070. India 678 only. Now, these are the figures of cases per million population. Now, let's take up deaths per million population of these 10 countries. Now you will realize why UK is number one on this table. Deaths per million population in UK are the highest, 662, followed by Italy 579, then US 412, then Peru 371, then Chile 370, slightly marginally less, Brazil 349, Mexico 282, Iran 157, Russia 80. Now look at India figures of deaths per million population. Only 18. That is why it's not really a gloom and doom scenario kind of a thing, if you look at these figures. Now, but if you look at tests per thousand population, then India figures very badly. In fact, only two countries are doing slightly better than India. They are marginally above India. Now, India is doing only 9 tests per 1,000 population. 0.9. Only 9. 9 tests per 1,000 population, which is way, way less. We are slightly better off than Mexico, which is doing 5 tests per 1,000 population. And we are absolutely at par with a small country like Peru, a Latin American country, which is also doing 9 tests per 1,000 population. But look at other countries. Surprisingly, here also UK is number 1. UK is doing 106 tests per 1,000 population. Well, in fact, if you look at, UK is not number 1 in this table. UK is number 3 with 106 tests per 1,000 population. The highest tests per 1,000 population are reported by Russia, 160, followed by US, 122 tests per 1,000 population. Then comes the figure of 106 for UK. As for Brazil, figures are not available. Well, in case of Iran is doing much better than India, 24 tests per 1,000 population. Now, while we do this comparative analysis, let us not forget one important fact brought out by the Indian Health Ministry, which is, while you see 1 million cases looks like a huge figure, but Health Ministry has stressed this point that the actual caseload of COVID-19 patients in India is only just about 3.3 lakhs, or 1/3. That is, or rather 34% of the total cases detected so far. So, in fact, the exact figure is 3,31,146, which is the actual caseload for India, which are the active cases. So, when you say 1 million cases, please make no mistake about it, that million cases is a figure referring to the total caseload, total cases detected so far. Now, another important fact is that some weeks ago, I had pointed out this fact in one of my video editorials about a month or two back, that at that point of time, the silver lining for coronavirus in India scenario was that not even 50% of India's 742 odd districts were affected. Now, the dark scenario is that 98% of districts, Indian districts, have reported cases, whether one case or more. 98%. Only 2% of the Indian districts are free of coronavirus. So this is a very serious situation. And of course, only 2 states, Maharashtra and Tamil Nadu, they constitute 48% of the total caseload of coronavirus cases in India. So if you resolve these two states, 48% cases will be wiped out. If we control, just if COVID pandemic fighting measures are implemented smartly in these two states, that is Maharashtra and Tamil Nadu, which together constitute 48% of the total caseload. Well, of course, then how the number of cases have gone up suddenly. A big factor is the fresh spurt in new cases in states like Assam and Bihar. And no prizes guessing for the reasons. Obviously, this has a lot to do with migrant workers. I have said in one of my editorials, you will be seeing this in one of the suggested videos here, where I had said that how India botched up its lockdown. India had observed one of the strictest and longest lockdowns across the world, 68 days continuously in total. Now, all over India. If the migrant workers' problem was taken into account, if they had factored it in, the authorities, then I'm sure that the cases wouldn't have come up so high. Well, corona cases, corona pandemic is going to change our lives for all times to come, at least for a good length of future which lies ahead of us. Well, friends, with this I come to close this video editorial of mine. I hope that you will like this video and you will subscribe to my channel, Rajeev Kishkindha. Thank you.